Hello, today we're going to be talking about anxiety and depression co-occurring with alcoholism. Our audience is those who are already diagnosed with anxiety or depression, and we'll be talking about how that diagnosis affects and is affected by alcohol addiction. 40% of people who abuse alcohol have at least one mental illness diagnosis. Also, 30% of people with mental illnesses have abused alcohol or drugs at some point in their lives. Anxiety and depression, as well as alcoholism, are genetic. Having a predisposition for one can affect development of the other, and having a predisposition for both affects that as well. So it's good to know what your family history is like and what you have a predisposition for. Because alcohol is a depressant, it can magnify feelings of sadness while intoxicated and negatively contribute to depressive episodes. If one is already experiencing a depressive episode or struggles with depression, being under the influence of alcohol can make that worse. The way that alcohol works in the brain can also magnify feelings of anxiety and nervousness while coming down off of being intoxicated, so being hungover. Additionally, many individuals who struggle with mental illness and alcohol abuse say that they used alcohol to help cope with the symptoms they were experiencing from their mental illness. Next, we will watch a short video from Dr. Paul Lind, who will tell us a little bit more about the relationship between alcohol and mental illness.
So 50% of people with alcohol use disorder will have anxiety and or depression. So the reason anxiety is common in this group of drinkers is that there's several reasons. So the most obvious is that alcohol withdrawal itself is anxiety producing. And so sort of the mildest form of alcohol withdrawal is a hangover or a bad hangover. But when you get to a certain amount of drinking, it then can progress from just a bad hangover to shaking, heart racing, sweating, nausea, lots of unpleasant physical symptoms. However, you also have very unpleasant psychological and mood symptoms as well. So that during a hangover, during alcohol withdrawal, the anxiety goes way up. And the reason it does is alcohol is a depressant. And withdrawal from any substance, you can pick any of those drugs out there. Withdrawal has the opposite effect of what the substance has. So alcohol is a depressant. It probably lowers your blood pressure and heart rate a bit. You feel calmer. So when your body's used to it, like, hey, I got to get that every day. But when you don't get it, you have the opposite effect. So you get a lot of anxiety.
There are many resources available to those who are dealing with anxiety, depression, and alcoholism. To start, some of the online or global resources that can generally be reached from anywhere through the internet is NAMI, which is the National Alliance on Mental Illness. They offer various tools such as podcasts, videos, online discussion groups, support groups, etc. They have a whole catalog that can be great for getting started, maintaining recovery. The DEA is another great one. It's the Drug Enforcement Administration. They offer step-by-step guides for finding treatment for drug use disorders, such as how to talk to your doctor. They also offer education about various drugs and their interactions with mental health. SAMHSA, which is Substance Abuse and Mental Health Services Administration, is a national helpline that is great for finding mental health treatment services in your area. So, like the other two resources, this one is fairly accessible from anywhere, and they offer a lot of the similar resources of education, support groups, helpful videos and things, but they also help you to get personalized treatment in your area. On to the next slide. There are many resources available to families as well. Once again, NAMI, the National Alliance on Mental Health, is a great resource for improving personal mental health. It's important for families and family members who are taking care of their loved one to also take care of their own personal mental health. This overall will help with family structures, family roles, and dynamics as recovery is taking place. Again, the SAMHSA, Substance Abuse and Mental Health Services Administration, provides multiple resources for familial support. such as how to support children of individuals who are being impacted by mental health and substance abuse issues. They also offer multiple pamphlets for understanding the steps of substance abuse treatment. Along with this, they have great resources such as the genetics and epigenetics of addiction, which can help family members to understand the complexities and struggles that addiction can have on a person's brain and overall functioning. Another one is the ADAA, which is the Anxiety and Depression Association of America. It offers education on how to talk to loved ones dealing with depression and anxiety, and it offers many personal stories that can help families to better understand what their loved ones are going through. Overall, there are a lot of resources that are available online, and many of these resources also offer local help for both families and individuals who are facing anxiety, depression, or alcoholism or other substance abuse disorders.
We want to reassure you that recovery is possible. These resources and others are available and accessible to you and your family to help take the first difficult steps towards treatment and recovery. The best time to start treatment is as soon as possible. 89% of people with co-occurring disorders develop the mental disorder first, so treatment should start early with anyone diagnosed with a mental disorder to reduce risk of substance use disorder. 49% of persons with co-occurring disorders do not receive treatment for either, and only 7.9% receive treatment for both disorders. As has been explained, both anxiety and depression and substance use are disorders, therefore needing professional intervention. This should mean treatment for both you and your family members. It might begin with an intervention with family, friends, or professionals, which may help you understand the benefits of change. The best treatment for co-occurring disorders is integrated treatment, which combines mental health treatment with substance use treatment, because the most common cause of psychiatric relapse is alcohol or drug use, and the most common cause of relapse to alcohol and other drugs is untreated psychiatric disorders. Research-based treatment consistently leads to reduced substance use, improvement in psychiatric symptoms and functioning, decreased hospitalization, increased housing stability, fewer arrests, and improved quality of life. It is provided in many locations and forms, including outpatient clinics as well as residential treatment centers. These can range from low to high intensity treatment. No matter the chosen treatment path, patients and their families are likely to follow the satir model of change. There are 5 stages, the first being the status quo, before the stimulus or the foreign element arrives. When treatment begins and changes happen, we move to level 2, resistance. Individuals start to resist the change and they drop in performance, moving to level 3, chaos. This is unfamiliar territory, people are less productive, they cannot function well. But naturally, this stage invites a transforming idea, which changes the person's perspective, and they begin stage 4, integration. The changes start working for them, and they find success in their new change. This exponentially increases performance until stage 5, or the new status quo. This is when the new lifestyle starts to feel normal. Studies show that recoveries do much better after 1 year of integrated treatment and have lower rates of relapse. That 1 year may include mental health intervention by motivational interviewing, cognitive behavioral therapy, various types of family therapy, group therapy sessions, and other forms of psychotherapy, combined with treatment for substance use with antidepressants and support groups for treatment. You will also work with professionals, such as social workers and case managers, to devise goals and plans through your time in treatment, as well as recovery maintenance after the full year or however long you spend doing integrated therapy. You will have many people to help you and your loved ones during this changing process. We hope you feel a sense of encouragement to begin that process today and hope you are more prepared to take those steps.